Hi everybody, we have some hacks for you, schema therapy hacks that are related to imagery rescripting. We've got two, haven't we, Rob?
We do, and we can deal with them, because imagery can be tough. Imagery scripting practice can be tough, and the clients bring all sorts of scenarios to the imagery and the processing. So we thought we'd bring two hacks to you, and Chris is going to go first.
Okay, so first hack for myself is normally we go into the imagery and go into an image, and we might deal with antagonists. We might deal with young children in the image. And we don't really specify who we are. Are we a person? Is it just me coming into the image and dealing with whoever?
Who should I be?
Is there?
Who am I coming with?
Who am I? One thing we could do that might really enhance the linkage to legacies and schemas and modes is we might sort of act like a teleported therapist. So instead of us going in and saying to the parent, listen, I don't like you doing that. That's not on. I don't agree with you. We could be saying something like, listen, I'm the therapist, and in 20 years' time, I don't want little Greg growing up feeling like he's defective. Or you could be talking to little you, saying, listen, hey, little Greg, you know what? I need you to listen to me because I don't want you growing up and having this self-sacrifice schema in your life. Okay, little guy? So, yeah, there's a quick little hack. So just don't necessarily, it's not a rule, you don't have to do this with everybody, but just a little slight variation of what we normally would do in imagery scripting.
It's the importance of being clear about who you are as you come in and address the legacy of the image, and that role of the therapist can sometimes help you win the exchange or something like this.
Okay. And link it to their problems that they have right now in their current life.
I like it. Okay.
Can you?
Well, my hack's a little different, but I think you could even use them in combination, perhaps.
Absolutely.
So my hack relates to, the situation where the antagonist might be just too abusive, or the situation is so unsafe that you're left really with nothing else to do but to take the child out of the image. That it appears, and even the child might say, oh, I need to get out of here, I feel unsafe. So in some scenarios, the need that you'd be addressing usually would be something like safety, could even be things like stability, and the child just wants to get out of there. They feel so unsafe, they need to feel safe. So, and then the question becomes, where do you take the child?
Where do you go? Exactly.
Where do you take the child? Do you take them to an uncle's house? Do you take them? No. Some of these things might be good scenarios to think about, and also even get feedback with your client about what would work for you. But something that I've found actually very powerful over the years in my imagery scripting work is to keep the option open of taking the child. Now I use my fictional client, Jenny, taking little Jenny to big Jenny's house. All right, so you say something to the antagonist like, right, you don't deserve little Jenny. You don't deserve to have a daughter who's trying her best and who, is a great little kid like this when things are unsafe. All right? So I take her out of here now. And I want you to imagine, and I always ask permission, of course, for the child. Would it be okay? Do you feel like you need to leave? Would it be okay if I took you somewhere safe? And the idea of imagining, now we go to big Jenny's house. Big, strong Jenny. The Jenny that she's worked hard to find her safe place. And she's got her own apartment. And in this apartment, no one can hurt her, She's got her dog, and she's got her blankets, and all the things that give her comfort and safety. And so I want you to imagine now, we're walking up the steps to Big Jenny's house. And I'm knocking on the door, and I'm side by side with little Jenny. And Big Jenny's opening the door. And I'm saying to Big Jenny, you know what little Jenny's been through. You know what she's been through. She's been through way too much. Things haven't been safe, and talk about the needs. And so I need you to look after her now. I need you to look after that little girl. And then you can do this thing where you change perspectives. And in this way, you're trying to start to invoke a little bit of the healthy adult. And you say, now, looking down at that little girl, what do you see? Oh, she's crying, she looks scared, all those kind of things. What do you want to say or do to that little girl now that she's here? what do you want to say to her to help her feel safe? Well, firstly, I want to give her a hug. Okay, do that. Can you imagine doing that? Give that little girl a hug. And you encourage the client to fulfill that, within the image. Give her a hug. Okay, now what are you going to say to her? And encourage the client from their healthy adult perspective to say some nurturing things to the child. And also do some nurturing things. Maybe what the child needs is a milkshake, or to a blanket, or to sit on the couch and to pat the dog or something.
I think that's what little Rob needs.
Maybe,
that's what he wants. He wants a milkshake.
Now, I just found this kind of dialogue to be a bit of a hack,
Fantastic.
and to be a really cool option for what to do in those situations where you need to take a child away.
Yep.
They might be, of course, left with feeling abandoned or feeling, other feelings coming up. And this is sort of symbolic of what we're trying to do in schema therapy, which is to start to hand over the reins as well to their emerging healthy adult mode.
Exactly. So
this is our latest schema therapy hack, focused on imagery. We could call this imagery hacks. Thanks for listening, and we'll see you around.
See you guys.